is the day today? So what is the day today? September? 5, great, thank you. How much is 100 minus 7? 93, thank you. 93 minus 7. 87? No. 86. Right. Thank you. Excellent. You find this funny, right? But it's not. One day, maybe you will feel that your brain is not functioning properly. And then you will go and see the doctor. And the doctor will ask you typically these kind of questions. And you know what's going to happen after the examination? Most likely, the doctor will tell you, I don't know what's going on. Please come back in 6 months or a year to see what's going on. And so you will wait for several months, maybe a year. You will come back and the doctor will tell you the same questions again. And probably he will tell you again, okay, please come back in a few months if things are not going better. If you are lucky, nothing wrong will happen. If you are not so lucky, at some point the doctor will tell you, now I know, you are developing Alzheimer's disease. It means that we have waited several months, several years, until the point we could start the treatment. And what we know now is that when you start a treatment at that stage, it's too late. All treatments that have been tried failed. So we think we need to change that. We think that the first time you go in to see a doctor for a cognitive complaint, the doctor should be able to tell you exactly how your brain will evolve, how your cognition will perform in the next years, 2 years, 3 years, so that we can use these years to try a treatment, try to delay the onset of the disease, possibly even to prevent the onset of the symptoms. How to do that? Nobody knows accurately enough all the biological mechanisms that lead to the loss of so many neurons and to the onset of the symptoms. We cannot use that to simulate how the brain will change in your future. So we can resort to the promise of AI. We can take a lot of data from different patients, give it to the computer, and let the computer do the job for you. Sounds easy, right? It's not. It's not because AI is good to predict the present. It's not so good to predict the future. AI is good to predict a diagnosis from a scan acquired the same day. AI is good to predict what you will buy tonight on Amazon. AI is not so good to predict what you will buy on Amazon in 5 years. There are so many things that can change in your life, that can change your centers of interest, that what you will buy on Amazon in 5 years is nearly unpredictable. And there is more. We have never seen a patient developing Alzheimer's disease for a very long time. We have seen a patient maybe 3 times, 4 times, 5 times maximum. And we have few snapshots of this patient. And we have seen another one twice, another one, etc. Each of these patients tell you a small part of a long story. And each patient tells you a story that is slightly different from each other. So what we managed to do is to develop novel methods, novel algorithms that could recombine and realign all this data to reconstruct the whole story, from the beginning all the way to the end. And while we are doing this, the computer learns also how the story differs from an individual to the another one. So we can personalize this scenario to the patient of a given patient, and then complete the rest of the story. I have spent the last 10 years in my lab to develop generic algorithms built on generic statistical and geometric principles. And the benefit of it is that we could use such principles for a very large, different kinds of data. We have used that for different types of brain imaging and also for clinical examinations. So here is the result. So what you see here is how the brain develops Alzheimer's disease during 30 years of time. Okay? We can do that over a certain period of time. Also, we have never seen a patient more than a few years. So on the top right, what you see is the thinning of the cortex. The cortex is the outer part of your brain. The more you develop the disease, the more neuron one loses, and the thinner and thinner becomes the cortex. And you can see that it targets just specific areas in a very specific sequence. On the top right is the consumption of glucose in the brain, the sugar. Your brain consumes a lot of sugar. But as long as the disease progresses, you consume less and less sugar in the brain. And again, it targets specific areas in a very specific ordering. On the bottom left, the hippocampus. The hippocampus is a small structure that is deep inside your brain and plays an important role for the memory. And what you see is that the shape of this structure changes over time because of the neuronal laws occurring inside and in the surrounding of the structure. And all those effects that you can see on the brain are now synchronized with the onset of the symptoms in the bottom right. So we have different functions that we assess. We have memory, language, concentration, and praxis. The higher the score, the worse is the performance. Then, of course, you see that during disease progression, the symptoms develop more and more as the lesion in the brain accumulates more and more. But there is more. We have some parameters that can allow you to adjust this global average model of disease progression to fit the data of a specific patient. So we can adjust, for instance, the pace of progression. We can go faster and slower. That's easy to understand. You can start earlier or later in life. But also you can change the appearance of the model. You can change the appearance, the precise timing and sequence of the different events that you can see in this model. So now look. When a patient comes to the clinic, the doctor will ask you the same questions. What day is it today? How much is 100 minus 7? And so on and so forth. Maybe the patient will have an MRI scan, possibly also a PET scan, even if it's not necessary. And then we'll have all this data acquired nearly at the same time. Now we can take the model. We adjust it to the data of this patient, and we let the movie go. And what we have shown is that during 4 years in time, we accurately predict exactly how the brain will change and how the cognition will be altered. So what's next? Next is to translate this outside of the lab and to evaluate it in the real life. So we are working with our collaborators at the Pitié-Salpêtrière Hospital in Paris to implement a clinical study in which we will evaluate the precision of these tools. One goal, of course, is to evaluate the accuracy of the prediction in a real-life setting and not only in the lab. But also, I think a bit more interestingly, is to evaluate how the clinician will adapt the tool, how it may change the way he interacts with the patient, and how we care them. Of course, next step would be to deploy it on a large scale, at national, European, or international scale. And we have seen today how much of work and effort still it needs to fill this gap. I have often met people from the tech sectors who believe they can disrupt medicine in 6 months. Don't forget, revolution in medicine takes 20 years, even with AI. Thank you for your patience.